Good morning.
Good morning.
I have given my presentation should we project it? My name, since this table did not introduce themselves, I shall introduce myself.
Thank you. My name is Agostino Munyiri. I'm a public health specialist, formerly working with UNICEF as a chief, retired happily, and a caregiver to both my parents from both divides. That's parents and parents-in-laws who are aging gracefully. Planning to move from a child to old age by virtue of the interaction with children at my workplace at UNICEF, and now being one of the senior citizens practicing. I'm learning to engage with old age and teaching people on how to move and maintain walking in 2 legs, not going to 4 legs. And I'm here today to share a few words on longevity. Thank you.
Thank you.
Thank you. That was actually a complete introduction. I shall introduce you as well. Mine is basically to just outline what health and longevity is all about and looking at it from a public health perspective. As you all know, the spiritual definition of health is a complete physical, mental, and social well-being, and not just the absence of disease. I think I would add to that definition also financial well-being. And because of that complete definition, I think that's why we have chosen a number of panelists here, the organizers, who will hopefully address all those aspects of aging, of healthy aging. And as the book had mentioned, we need to remain on our 2 feet. Human beings were upright, were made upright. So the legs that you have now, and the heart that you have now, we're no step about it. The liver you have now will need to carry you to 100 years. So you need to find a way of taking care of it. And my approach to longevity, health and longevity, is from a health perspective. Because I believe that if you know what is killing us, if we know what is making us frail in our old age, then we are most likely to try and start preventing it so that we remain agile in old age, healthy, and of course in all aspects as per the definition of the WHO. When we were downstairs introducing ourselves, I was very happy to hear about Mtuku. He's got good aging genes. I think your grandfather passed on at 100 something. And I think the other grandfather on the other side, somebody also passed on at about 95 or something. And they were still walking. And the beauty about one of them is that they were admitted, basically, and then they just passed on quietly. No underlying ill health. Okay? No underlying ill health. They went to sleep quietly. And it's not every day that you hear people announcing funerals that so and so. That's what they do, because people basically hide what people die from. And my take is that we should really try and, as part of my approach, because we've had many of these talks, but from angles of basically looking at the old person. I'm trying to look at the whole lifespan of us, right from childhood. Because If you don't know, you might have not known this probably in your school, when you went to school or college, that the programming for good health starts during birth. You start during birth, it's breastfeeding. Those children who are exclusively breastfed are likely to live longer without ill health compared to those who are not breastfed exclusively. So it starts even from the time you're in your mother's womb. How well is your mother going to take care of that pregnancy? Your mother and your father. Is that child talked to while they're in the womb? What are you taking when that child is in the womb? Because the programming for diabetes, the programming for hypertension, the programming for the diseases that start taking us down in old age manifest in your womb. So those of you who are not married here, try and look at your future spouse, your future partner. Look at their birth, the child health card. How heavy were they when they were born? Don't start from the mannerisms of them at 20 years, 25 years. Look at how they were born and how they progress in life. Because all this programming of diseases are born at that time. So, as I said, my approach to this topic is through a health perspective. But just a snapshot of where we statistically-wise. It is projected that there will be about 4.7 million of us over 60 by the year 2050. We will be more than children under one. In fact, beyond that year, the old people will start basically being more than the children. Is the country prepared to take care of the old people at that time? 9% of the population will be about 9.7% of the population. Currently, we are only 3% of the population. We're about 1.7, 1.9 million. So we're not that many. And 1.7 million, ideally, the government should be able to take care of us. Whether we paid our pension, whether we contributed to NSSF or not, they should be able to take care of us. Not because of anything, but because we did our contributions. And they owe us that. Our families ideally should also be able to take care of us. But moving forward, this might not be possible. Burdening the families to take care of the old person. Because when I retired 4 years ago, I was really looking forward to retirement. I did not know that my aging parents are waiting for me. And it is a full-time job. I'm currently living with my mother-in-law. She's only 83. But she's frail. She's in a wheelchair. She should not be in a wheelchair at 83. I think I made a mistake in buying a wheelchair. Mistake number one, they need to be mobile. Okay? Because if you're not mobile, of course, other things start coming in. So I don't think anybody here plans to take care of their parents. But if you don't, if you're at a younger age, you probably might have to start considering that as well. The life expectancy currently is about 67 years and 70 years for women. So the young girls currently here, you should be able to go up to 70 years. You reach there, isn't it? With good care, good everything, you should be able to get there. And when you compare this to Japan, which has just been mentioned, which is about 85 years. And they don't have necessarily the highest longevity. We have places like Monaco that actually goes beyond 85 years. So aging populations need everything that I mentioned in the definition of health and also financial planning. Now there's always this misconception that aging is associated with ill health. It need not be. Aging is not synonymous with somebody who is frail or somebody who has ill health. And your example of your grandfather who passed on in their sleep, they had no underlying condition. So we should not, aging and disease is not synonymous. And the idea that aging is now time to go home and die, that is a wrong concept. We should be able to live healthily up to those age, up to the age that God has granted us. And this is because the habits that are built early are going to shape our health in old age. The habits that are built early are the ones that are going to shape how you're going to age. Future elderly are people here. We're all the future elderly. The other causes of death not permitting. And early preparation ensures better outcomes. So as I said, my approach is basically through the disease. And I use this diagram. Sorry. Next slide, please. The bar chart. Next slide. These charts basically show the leading cause of death in high and low middle income countries. And Kenya is most likely somewhere in the middle. And you can see that in high income countries, what is causing the greatest number of deaths is disease of the heart, the cardiovascular illnesses, and even then they're declining. When you compare the data between 1919 and 2000, the round circles that are filled in is 2019, and the empty ones are 2000. So you can see that the diseases in the developed world, the majority are non-communicable. So they, unlike us, who have still have malaria, diarrhea, and illnesses like those that are the major killers. In advanced worlds, it's the cardiovascular, it's the cancers, it's the dementia, it's the Alzheimer. Are we beginning to see that in Kenya? Yes. The trend is now changing. We're now beginning to see the dementias and Alzheimer's being also, will start contributing to the top 10 killers of our people. Now when you compare that to the developing countries like ours, yes, we still have heart disease, and we still have stroke, and then we have lower respiratory infections, diabetes, cirrhosis of the liver, those popping up in our environments. And those are the illnesses that we need to guard against from this age, in the year 20, 30, 40 years. Because you want to enter your age 60 when you're disease-free. If you enter age 60 when you have any of these illnesses, then your lifespan is definitely going to go down. And I'll be going through why the importance of keeping these diseases at bay, so that by the time you enter the age 60, they do not interfere with your health, they do not interfere with your upright posture, because you need to keep moving, and you maintain your good health into the year 100 if possible. Now, why do I choose the disease-based approach? Because human beings change. I mean, we all know about nutrition, good nutrition, long life. But we preach about it, but who changes? Nobody. We talk about exercises. You go out today, you do a bit of jogging, next day you're tired. So I thought that probably if we look at the diseases that are killing us, and we might probably start changing. Now, I got that idea way back from when I lost a few of my relatives. There's one relative, when AIDS first came into being in the 1980s. And I think I normally pat myself on the back as being the first medical officer to announce the presence of HIV/AIDS in Kenya. When I was an intern in Kakamega in 1983. And I had to run away from my office because the then minister, Matiba, was looking for me. Why did I do that? How can I announce that there's HIV in this country when we know that it's not there? But then I'd seen it in the ward, and I decided to make an announcement. Needless to say, I was not the most favorite person in town. But then I still believe that at that time, behavior change started happening within Kakamega. The bars emptied out, at least for the next 1 week. The ladies of Twilight did not want to see me. I interfered with their business. So there's some element of behavior change if people know the diseases that are affecting you. If you know that you have hypertension, you start changing your lifestyle. If you know that you have diabetes, you start changing your lifestyle. And as I said, I lost a sister way back in 1970-something, 76 I believe. No, sorry, 2002, from HIV. And in the funeral, everybody was talking about all the things that people talk about, but not the cause of death. When I announced that after the service, everybody was coming to me, how do I get tested? Where can I go to? But this idea that so-and-so died of lung illness, so-and-so died of what, I think we need to change. We need to change that as part of an approach for behavior change so that people start changing their behavior based on a knowledge of the loss of a loved one or the loss of an important person in society. If an important person in society, if they announce that they died of A, B, and C, many of us will try and look at how did they live their life and how can I be different so that I don't head that way. Okay? So the disease-based approach, there are many other approaches that one can use, but I believe this approach mainly focuses on not those of us over 60. Because in a way, time for this is probably over. But for the 20s, the 20-year-olds, the 30-year-olds, they need to know this so that they start changing their behavior now, if you want to remain active in old age. So what are the challenges? I think the latest data here shows the challenges facing all the Kenyans. The graph?
Yes.
So 11% of those over 60 are already reporting some form of chronic condition. Okay? So that's about 10% of the 1.7, over 170,000 are already reporting some kind of chronic condition. Disabilities, especially mobility, is 8%, visual, cognition, the dementias, Alzheimer's, the hearing, difficulties, about 43%. And trust me, I can probably hear you from here, but I have hearing aids already, which I got from going for my routine medical checkup, where they found that this ear basically is worse, hardly ever hears. And I was wondering why when my wife is looking this side, I keep on saying, repeat, what are you saying? Until I discovered that they discovered during a regular checkup that this ear is actually worse than my right ear. So, hence the hearing aids. And over half are living in absolute poverty. I think it will be mentioned by my co-panelists on how we need to guard against this poverty. Those who are aged, who are old, need not live in poverty. Not in a country that says we are approaching middle income or we are progressing financially. We should not have the people who have contributed to this country in the youthful age living in poverty. Hypertension. it affects about 1.9 billion people worldwide. The prevalence in this country is not known, but hypertension, I think, is around the 4th or 5th most common cause of death in this country. I'm sure if I had a blood pressure machine and took the pressure of a good number of us here, you'll probably find that a good percentage already has hypertension. And it's not something that you feel. You start feeling it when the pressure is very, very high. Otherwise, half of the people with hypertension are moving around without even knowing that they have the condition. It only manifests probably when one has a stroke or a heart attack. That's when they realize during admission that they've been having hypertension. And in my case, how did I discover that I had hypertension? Some palpitations. And then I wondered what is wrong with my heart. And this was 2002. So I go to the doctor, they take the blood pressure, and I think my behavior change was because of what the doctor told me. He told me, continue with this lifestyle, you will be dead in 5 years. I was obese. My pressure was going up. Work was also very stressful. And it needed a shock treatment from my doctor. Continue this lifestyle, and I've seen people like you, they do not go beyond 5 years. So by 2000, I should not have been alive in 2007. But I changed my lifestyle. I started moving, I changed my diet, I changed my nutrition. I reduced my drinking. Not stop completely, I'll touch on alcohol. So in symptomless, unless very high, over 180, about 120. And for those of you who've taken the pressures, you'll see the way the cuff tightens on your arm as it lowers down. Now, when in the old days we used to use a stethoscope to hear the beat of the heart when they're taking the pressure. Now you need to imagine that pressure that you're hearing, you're feeling in your heart when they're taking your blood pressure. That is the pressure that is being exerted on your blood vessels in your brain, on your blood vessels in your heart. And these are very, very thin vessels. So either they burst, or they thicken, or they become, so they start contributing to dementia and Alzheimer in your old age. These are the things that bring on these diseases in your old age. So if taken care of earlier, you prevent yourself from this kind of condition later on, beyond 60 years. So risk factors are overweight, obesity, physically inactive, high salt diet. You find people, there's already salt in the food that they still want to add. Stress, genetics, sorry. And the lifestyle changes here are sit less. In fact, we should, I don't know how long we've been sitting for. If it's for 1 hour, we should have actually stood up to stretch your legs. Because sitting is now the new smoking. And it's something that is now being addressed even in banks. I've consulted 2 banks, KCB and Equity. They've employed wellness officers. They do not encourage, even for the cashier, they do not encourage for them to sit for more than 1 hour. They have to get up and walk. There are offices where you do not find this kind of seats anymore. In fact, you have working stations where you actually work standing. This is a dangerous thing in old age. And it starts at this age. Sitting is the new smoking. And yet, we're still manufacturing quite a number of seats that do not allow us to stand and move around. Physically active, which can include walking, running 150 minutes a week, strength and flexibility. I think all these have been presented in previous aging forums, all the constant forums. and I don't think I need to go through them, but there are habits that we need to start putting in place early. And where does hypertension, I've mentioned that I think is the second or third highest killer in this country. Diabetes. This is elevated levels of blood sugar with damage to the heart, blood vessels, eyes, kidneys, and nerves. My blood sugar is hovering around the borderline, despite all my efforts. But thank God, they've not seen the need for sort of treatment. But diabetes, I think, is listed quite high up in this country. I think it's around the 8th commonest killer. And you have it when you enter 60 years. It's going to reduce your quality of life during all as one ages. So regular medical checkups, exercising regularly, eating healthy, reducing carbohydrates, controlling blood pressure and lipids, and quitting smoking cuts your risk of developing type 2 diabetes by about 30–40%. Is this what the Japanese are doing? I kind of ask this question. Yes. They are moving a lot. Their diet is nothing like what we eat. Our diets are, I think, probably the whole of Africa. We are in trouble with our diets. Some big ugali, 3 or 4 pieces of meat, very little potatoes. And then we leave the table when you're full. The Japanese, they push away from the table when they're 80% full. You don't eat until you feel satisfied. You push away from the table when you're 80% full. Their meals are small portions of many, many things. It's carrots here, fish there, weeds from the ocean. So a lot of traditional, what they call the traditional foods. We need to find a way of moving away from maize. Maize was never meant to be human food. It's for animals. And I discovered this when I was working in Lesotho. Lesotho at the time, when I reported there in 2003, had an HIV prevalence of 30%. Kenya, Uganda has never approached that level of HIV prevalence. Where you walk into a bank and you can just see every other third person has got HIV/AIDS. From the way they look. And this is now the food, not AIDS. But how did I learn that nutrition is critical? We went there, of course, with my young children, and we would try and test our workers, our gardeners, and the lady of the house. Thank you. We tested them for HIV. But after a while we stopped because they were all, the ones we tried to recruit were all positive. So we just, at that time, of course, HIV was still new. We were scared of, what might happen to my children if they come across their toothbrush and they're using it. So we decided, okay, we'll leave it all to God. But let us just still have them. Now, they work for us, and they would share in our meals. Everything we ate, they also had the same thing. And I'd go on home leave. We go on home leave once every 2 years. When I came on home leave for about a month, they'd go back to their places. So before they go on home leave, before we went on home leave, they were healthy. You could see that they're thriving. But 1 month of them staying back in their homes, I'd come back and find that they've lost weight. Within 1 month. And they wrote an ARVs. So it was the diet. I'm assuming that we were eating a fairly balanced diet and sharing with them. So that kept them healthy. And in fact, if you remember when President Beki once announced that HIV is not caused by a virus, he was really against this idea. He said it's nutrition that is causing HIV/AIDS in South Africa. He had a point, but his people who deliver messages, his communication people were not good at communicating. Because the diet of maize is right, Southern Africa, East Africa, I think only Uganda, I believe, has a fairly good diet of bananas. A bit of traditional food still remain in Uganda. But in Kenya, you need to do something. They say that it's fortified, but how much fortification is done in that maize, and how much do you need to eat to meet your daily requirements? And another place I've seen the beauty of nutrition is my mother-in-law. Basically, because of Alzheimer, after a while she stopped eating. So we had to fix the peg tube. And the peg tube, we had to bring in what you call Ensure. Ensure is a package. It's not available in this country. I don't know if it's available in Nairobi Hospital. But it's got 2,000 calories, 200 calories per tin of 200 ml. And she takes 5 of those. Within 3 weeks of taking those, she started speaking. She had not been speaking for about a year. She started speaking, her weight started going up. Again, mentioning the importance of nutrition. So diabetes, we have to guard against diabetes. There's a bit about diabetes. If caught early, unlike hypertension, if caught early and you have lifestyle changes and you're on treatment, you can actually go into remission. The disease can actually go away. Lifestyle changes, medicine, and so on, and diabetes. You don't have to be on drugs for life, but you have to be disciplined about the care, one's care. Liver cirrhosis, not necessarily, okay, it's a killer, but not necessarily in old age, but it would be nice to actually enter your old age with a very fresh and active liver, and you can see what alcohol does to the liver. Next slide, please. No? Yeah. So yes, alcohol is a social. Basically, we drink it because it's a social. When you go to a gathering, it's made available, it encourages people to get together, you talk about as you sip on alcohol. But I'll show you later that the drinking that takes place in this country is anything but social. And this is the damage that it does to one's liver. Causes 3 million deaths annually. The prevalence in Kenya is about 11% prevalence, and 3.2 million people are affected, and it's mainly because of alcohol. Now, if you have a fatty liver, which those of us who take alcohol moderately here, I'm sure if you went to an ultrasound, you already have a fatty liver. So you're already about stage 3, and not stage 2. So from there, fatty liver, you start changing your habits, it will improve, go back to normal. If you continue those habits, it becomes fibrosis, and then you get cirrhosis, and your liver packs out. And I don't think there are many places where you can get a liver transplant in this country. So the main culprit here is alcohol, but of course you have hepatitis, the infections, hepatitis B, hepatitis C, that have vaccines. Vaccines are now available against those two hepatitis. But alcohol was never meant to be taken by humans. It destroys the cells, DNA, everything. It's never meant to be taken. I know WHO or not WHO. CDC used to say 2 glasses of wine for men, and 1 glass for women should be the limit. But that has been discarded. It was false. It should be no glass. Next slide, please. This is an old map that just shows the alcohol episodic drinking. which I think is really taking place a lot in this country, where people do not no longer drink for pleasure, but to get drunk. Young people go to the bar, or whatever it is they go to, and they are drinking to get drunk. And as you can see here, the prevalence, we're almost catching up with Russia. We're about, I don't know the figure, about 45, which is high. And this is about 2016. If this is done now, I think we are probably worse than this. We're probably amongst now the top. Those of you who know where you come from, your environment, you're aware about how much drinking actually takes place. And the beers are expensive because, and what people do, they revert to the third generation drinks, which are much cheaper and lethal. People have said that if Kenya breweries had a flat rate for beers, probably people would stick to beers. We probably, you don't have episodic drinking with beers. You fill your stomach and you get full and then you go. But this third generation spirits are lethal and should not be taken. Next slide, please. Now this is one area that I just want to mention, but we really do not know yet. I remember I asked this question to Dr. Townsend. Yeah. Is there, have we studied HIV to find out how it affects people in their old age? Not just the disease, but also the medicines. Because I know the first generation drugs were leading to fat deposits, moving the fat around where the heart is, which is not very good for the heart. So those are the initial drugs. So we don't know what the other drugs are doing currently, and most likely the survivors of HIV/AIDS of the 1920s, 2020s have probably not reached an age where we can monitor what is the impact of HIV/AIDS on the older person. But it's important that what we know, you know your status, because once you know your status, it will change your behavior. But how many people are prepared to go and know their status so that their behavior changes? We had a fight in Lesotho when we launched the Know Your Status campaign. And all the cabinet ministers chose to go and get tested in South Africa because they were afraid that word may go out about the results. Probably, from the way I'm saying, I don't know whether Kenya now needs to have a campaign so that everybody knows their status, so that we then change our behavior, because I understand that it is now on the increase, and the latest data shows young people, and they're being infected by older people. Okay? One partner at a time, and use of condoms. So just to summarize now, the physical health, the first pillar, the physical health, exercise regularly. We have gadgets now that can monitor how regularly you exercise, maintain healthy weight, avoid smoking and excessive alcohol, get preventive health checks early. And we are missing opportunities for this kind of health checks. I recall the grade 10s were going to school, and I think one of the requirements was a doctor to sign off on their health report, on their status. And for those of you who remember taking it to a doctor, I don't think there was any examination happening. They were just signing off. Why deny this child an opportunity to know what their health status is at that age, so that at least we have a baseline of where we are? Because the next time that child will come to our facility, maybe when they're 30, 40 years. Okay? So preventive health checks, start them early. Nutrition, I think I mentioned that. Very difficult to change, but we need to start that. Japan actually starts this in schools. Those of you who've been in schools, the diet these children are eating, I don't think you can even feed your own dog this diet. It's terrible. Start in school calculating good nutrition habits, and then hopefully that will then translate into good diet, good feeding, good nutrition later on in life. Are we on prevent diabetes, hydrate well, limit sugar, salt, processed foods? Financial preparedness, which will be dealt with my colleagues here in that area. Plan for independence beyond 65. We are hoping that, yes, our children may take care of us, but then when you think about it, why do you want to put that on the children? There's a question that will be answered by my fellow panelists. Anticipate rising health costs. You have to be intentional in this. Find a way, if you have health insurance while you're still working, find out how you can maintain it. Because those costs are going to go up. So preparing for rising costs, lifelong learning to stay relevant. I don't know how many, we have now gotten used to these gadgets where we read from them. It's very difficult to read from your mobile phone unless you're looking at social media and TikTok. But we have to go back to reading books, and especially fiction books. Because that's where you have to remember the names of the people that you read in the book. You have to remember what they did, what they said. And you cannot do that from just reading newspapers. We have to now become a reading culture and set up areas where people can meet, especially the old people, to continue reading and interacting with the other generations of young people. Support healthy city and community policies, invest in aid-friendly environments. If we want to walk, then we have to have walkways. And we have to have walkways that are not littered with borders. I think those of you, I'm sure some of you all know somebody who's been hit by a border on the walkway. I think I've lost 2 people so far. One was in this town. So yes, we want healthy cities, but then we also need laws to stop people from using these walkways as ways to get to places much faster. We need cities where people can go to and have an intergenerational sharing with young people. Invest in aid-friendly environments. And then information tips, I don't think I will, last slide. Information tips, second last slide. Check your weight, regular medical checkups, frequent aerobic exercises, reduce alcohol intake, watch your diet, know your HIV status, plenty of sleep, and plenty of sleep at the right time. Because not sleeping anytime is restorative. You need to go into those the REM-free sleeps, where you dream. And I know people are talking about 8-hour sleep, but you have to have that sleep that brings about dreams and so on, the REM sleep, to have restorative sleep. And to do that, of course, means quite a number of things. You don't have to be waking up at 60 years, going to the toilet, because that's going to interfere with your sleep. So you have to find out how best the sleep cannot be interfered with. Group outdoor events, at work, movement, I've mentioned that, regular breaks, reduce stress, charity work, voluntary work, maintain healthy meals. At health facilities, I put a question mark there, because if we encourage people to go for medical checkups, I don't know how many of you have been to a health facility in this country, especially a public one, even a private one, like a car. First of all, you'll probably be seen 3 or 4 hours later, and you just come for a simple medical checkup. Secondly, health facilities are not designed for the well. And actually, it will be overwhelming. The health facility. So we should be intentional in setting up some wellness clinics. And Japan has this, where they have wellness clinics all over. Where people who are well just go there for the checkups. They even go there because cancer is a big killer. They go there for their genes to be checked if they have a gene that carries cancer. All that is available in wellness clinics. We don't have to take up time of the health facilities that are there to treat them, to take care of the sick. So regular checkups, if you can find a way of setting those up, even at a community level, that will work. And of course, vaccinations are now available. one against cervical cancer, hepatitis. They won't have it. So get those vaccinations, and for those over 60 years, get your pneumococcal shots and influenza shots. Because what will eventually take you down, even if you are well in your 60s, 80s, 90s, apart from sleeping dead, waking up, going to sleep and not waking up, which is the best kind of death. And that is listed, by the way, in Japan is the number 4 highest killer. Old people at 100, 90, they go to sleep, they don't wake up. No illness whatsoever. And it's listed as the 4th highest killer, if you can call it a killer. They just slept. So vaccinations are there. Pneumonia is a big killer in Japan for the elderly, because body then starts fighting illness and become difficult. So the vaccines are there, get vaccinated. And then the gadgets that you must have in the house. Have these gadgets available. You can take your own blood, you can test your own blood at home. The COVID test, the respiratory rate test came during COVID, have it in your house. You'll know if your lungs are failing. Blood pressure machine, you can be taught how to take your own blood pressure, a weighing scale, a tape, and the latest gadgets. The latest gadgets is the watch that tracks your steps. And you can set your own target, like 10 steps, 10,000 steps in a day. And not just doing it for yourself, you can program it to compete with other people around the world. I'm currently using my Samsung to compete with 1.7 million people worldwide. And the Koreans are actually leading in the number of steps they take per day. And I'm trying to catch up with them. So every day, you can see where you are. You can pick some people to walk with. So you could be walking alone on the street, but according to your Samsung, you're walking 1.7 million other people. And at the end of the month, it gives you a breakdown of where you are. How well did you perform compared to these 1.7 million? That then keeps you active. So all these gadgets are now available, including a ring that can track your steps and monitor your movement. So I shall stop there and hand over to the panelists for the other elements of aging. Thank you.
Thank you. Wow. Thank you, Dr. Agostino Munyiri, former UNICEF Chief and a longevity expert. Wow, how was that session? Did you like it? Yes. There are some things you have taken, Cindy. So while we set up for the panel discussion, I know we have reactions, questions, remarks. For me, what I've picked is that we need to watch our diet. And I'm a whole nutritionist. I'm feeling tunaanguka hiyo sector. Yeah? So let's have reactions. Any question, any remark, anything that you're taking from this session in the next like 5-10 minutes when we set up the podium for the panel discussion. Because now we are going to go deeper. He has talked about lifestyle. He's looked at longevity from a disease perspective. Because once you know of a disease, you know how to avoid it. If today you are told you are pre-diabetic, you will be very careful in regards to how you're watching your diet. And indeed, these things are killing us. Watu wanapenda makali. Kununua tunaangalianga 40% label. Sindio? Na tumemba, alcohol was never meant to be taken by. But society defined enjoyment around what? Alcohol. We've defined enjoyment and good life with akina KFC. You know, if you've done well, your child, you buy them the KFCs. They don't know broccoli. They don't know salads. They know my deep fried chicken. Yeah. So it is a call. It is a call. Like if we want to live longer, hey. Already right now, some of us are not even in our 60s and we are already on medication of something. Somebody is taking something. Now, by the time you get to 60, and you've been told at least if you get to 60, if you have avoided those diseases, at least you're going to live longer. Your quality of life is going to be different. Yeah? We used to think diabetes is a it is a chronic condition. But do you know that actually with the diet, there's a way you can reverse it and manage it? Actually, people that understand their diabetes and are able to control it with just diet, they don't need to be on medication. So these are things, and you know, the human nature can adapt. So whatever probably we grew up thinking is the right thing, we need to do what? Unlearn. And do what? Relearn. Yeah? Guy, can we stand up? We've been told that sitting is the new what? Is the new smoking. Ambassador, how are you? How are you? Good to see you.
Very well.
Good to see you. He's made it all the way from Thika. Yeah? Can you stretch? Can you stretch? And if you touch the person next to you, move a little. Stretch. You know? You can bend, try to touch your toes. See whether you can really touch your toes. Stretch that back. Yeah? And so Nasike will help me moving around the tables, and we pick a reaction from each table as we set up. We are setting up the podium, and also the team online. Please type your comment or reaction on the chat, and we will be getting back to them. Please, let's have a seat. Let's have a seat, and we pick a reaction from each table in regards to the wonderful presentation that we have had from Dr. Agostino Munyiri. Yeah? Oh, the tables had names. Yes, Maureen, please. Help us with that.
All right, I just, Dr. thank you so much for that. Now when I'm going to look for a spouse, I'll start asking, mama yake, huyu kijana alizaliwa akiwa na kilo ngapi? I need two things. I need a mental health certificate, and I need to know how much this guy weighed when he was young. So I picked that from him, and I also am happy that you also take Uji, so I didn't feel very judged. Okay, so we start with, cupcakes. Cupcake, what did you guys get from the presentation?
Thank you very much. I'll start. My name is Kanyinge Michael. That was a moving presentation. But what I grasped is almost the last sentences about age-friendly environment. We need to really think about how we can enhance age-friendly environments, not in the city only. What happens at home? I just wanted to share something. Somebody out here, I told him we get from ground floor to the 5th floor, and he's my son. By the time we got to the 3rd floor, he was panting. He was ready to go. I was also ready to go to the other 5 floors. So we need to do something about that. I'm happy. That is a good presentation. I wish we could get that date and people keep listening to it. Thank you.
Thank you. Pigeni makofi kidogo. You guys were the giraffes. What did you guys get from the presentation? My lovely, unajua nakupenda.
She's always against me. Now, I think if we worry too much, it's not healthy. Because that makes you think, oh, I must eat, I should not eat meat. No. I think in my life I can eat anything. But at the same time, I feel exercise is very important. I walk all the time. At least even if it is a few kilometers away. Every day of my life I walk. And then I encourage other older people, cleanliness. You know, you don't need to wake from your house and then just go. You have a good bath, you have good breakfast. But then, when you walk outside there, people should not say, no, you should be clean. And I always tell my older people, when we leave our houses, we must be clean. Yes. I was in Japan. Is he a doctor?
Yes.
There is is something about sleeping. Some years ago, I went to Japan for a program. And I realized wherever I slept, I was sleeping on the ground. They don't have beds. I don't know whether they are old, but I slept on the mat, on the ground, and not on the bed. So I'm wondering, is the bed bad for us?
The bed is the problem. Mambo ya 5 by 6, mtoe kwa hizo nyumba. From today, you sleep where? The bed is there? Joey, this table, what did you get? Pick. Okay, I'll come back for more reactions.
Okay. My name is Samuel Mwangi. I want to thank Dr. Munyiri for that very, very insightful presentation. My 3 things that I've picked is the importance of neonatal health and infancy health to the outcomes of health in old age. I never knew about that. And Maureen, you already said that you utapata the card for the
kilo.
Yeah, yes, very important. The other one is we can use technologies to monitor our physical health. That is very important because now we can leverage on the existing technologies in managing our health. My final one is the impact of starchy food. We all like starchy food, isn't it? Especially that part that we cannot, the maize was not meant for human consumption. That's amazing to me. That anything that is corn, maize product is not good for health. But I also have a question for for Dr. Munyiri. What about wheat products and milk products? Because I know nutritionists are also very much against those kind of foods. Thank you very much for that.
Thank you. Beginning my coffee, I think we're ready for our panelists. I will still get more reactions in the room after the panel. So they sit, they do their session, and then now we have reactions. Okay. Ready, McKenna?
Yes, thank you.
All right, thank you so much.
Thank you. Please feel free to, in case you have we have not taken your reaction or your feedback, you can still put it on the chat. Write it down. You can pass it over to our speaker. He'll still be here and he'll be reacting to it. We have captured 3 reactions. Number 1, in regards to longevity and age-friendly communities and cities, as raised by Michael Kanyingi from Michael. Pauline Makwakra from Senior Women Citizens for Change. She has asked us, is the problem the bed? Should we be sleeping flat on the ground? And then the last reaction, of course, we've gotten from Dr. Samuel from Kenyatta University. So I'll give you 2 minutes to react to that, and then even as the panelists are taking the seats. Yeah, over to you, Doctor.
Thank you for those very pertinent questions. And what is encouraging about the questions is that, unlike previous presentations, I've been asked about questions that relate to health. People basically becoming personal in the question, which was not the case here. Yes, the bed issue. I may have to do research on that one, but most likely it has to be the hard surface, because most of the initial bed that we used to have was a spring type, and you know what happens with the springs, and the mattresses also start covering it. But the bed type, do they have mattresses or just flat? Mukeka, yeah. So that is good for the back, it's good for the whole body posture, okay? So that will definitely give you good sleep. I think the beds that are wooden, but then of course you still have to put a mattress on them. And it's the mattress rather than the bed. The mattress is the carpet. Forget about all these adverts about Mr. Mattress, this has got I don't know what inside and what. Eventually it will start and it will not give you good sleep. Okay. But I'll need research. Thank you for your question. Wheat, milk. The thing about milk, that's a child's first food. The only difference is that now, when you grow older, we're now moving over to cow's milk. And I think we probably need to analyze what is the difference. Is there much difference between a cow's milk and a mother's milk, human milk? But wheat, especially if the grain has not been removed, is definitely better than maize. Wheat, it's got a higher glycemic value, meaning that the absorption into conversion to glucose and then into the bloodstream takes is much slower than from maize. Okay, maize will shoot up maize. Even the case, because this is flour that is actually the surrounding has been removed. So its glycemic of that cake is very, very low. I mean, it will be absorbed into the bloodstream very, very quickly and start taxing your pancreas to produce insulin. And that easily will contribute to diabetes. So wheat, yes, brown bread, anything that will be absorbed slowly is recommended rather than. And interestingly, rice. Rice is a major staple food for the Japanese. But then I think there are quite a number of different types of rice. But the rice that I think they've removed the store, and their portions are much, much smaller. They're not like our portions. Rice, we want to fill it on our plate and so on. So the portions are smaller, but it goes with other foods. What was the last? Third question was from? Yes. That goes without saying. The question is, how do we move to getting those centers? They were there before. I think if you're there in the last symposium, he was actually leading a group on that topic, on environments that are ideal for the older people. In the old days, we had social halls where people would go to and interact, intergenerational spaces. Older people meeting with young people. That really helps in healthy aging. But we need to set those up and hope that they remain places where all people can meet the community and interact. But the churches are there. I think the churches need to go beyond just being used on Sundays and Saturdays for prayers. I think they can be converted into places where all people can meet.
Wonderful. Thank you very much. Thank you very much, Daktari, for your quick remarks. I think this is a discussion that can keep on going. I hope it is sparking something in you. You can just view here. Yes. And now we are progressing on to the panel discussion.